Hi, Nurse Jacqueline here. Today we're going to be talking about Morpheus at PCH MedSpa. So Morpheus is a combination of radiofrequency and microneedling, really good for acne scars, reducing pore size, and also helping with skin tightening and textural issues. So a few questions that we often get asked is, are there any patients who can't do this treatment?
Exactly. So Morpheus RF is a very versatile machine. Certain people with skin colors, if we go superficial, that can be problematic, as we've seen just a few cases out of the thousands of cases that we've done here, Jacqueline. So that's the only contraindication. Otherwise, everyone can get this treatment. It's super safe. And as you know, this creates a small blood clot under your skin. So that's what the needles of Morpheus RF do. What has been your experience doing the treatment for almost a year or more at PCH MedSpa, Jacqueline? What do you think that this does to your skin?
So a lot of people really do like how it does minimize the appearance of the pores. They notice it around their cheeks, and also they notice the skin tightening effect. So when they come back, or after they're done with their third session, they definitely do notice that their jawline is much more defined, which they really love.
Great, great. This treatment, the beauty of it, you can administer just with topical numbing, so it's a little bit safer and less invasive compared to face tight, body tight, or the endolift that we do here. So in that sense, it's a little safer procedure, okay? We just use topical numbing, and we can treat different depths, as you guys do, 1 millimeter, 2 millimeter, 3 millimeter. At 4, we reach the fat, and it has the ability to produce fixed mode, so the needle goes in and stays, and with that you can melt some fat, which is really nice. But for texture improvement, as you've seen, we go superficial, we deliver delicate energy. It's very operative settings, folks. So if you're thinking about Morpheus, make sure you go to a clinic that they've done a lot, okay? Because as straightforward and safe as this procedure is, still you can run into complications. So, and if you want results, the provider, Nurse Jacqueline, Nurse Kim, and myself, you need to be experienced and know what you're doing, what settings you're doing, what depth you're doing, and how many times you're doing. So it's a lot of details. That's what really makes differences between med spas is the results. And it's all back to operator dependency. What else do you have to add?
A lot of patients also want to know what the downtime is.
Very good. So downtime is just 1 day of redness. It's very easy. As we know, we always send patients home with topical arnica. Also, we apply stem cell or exosome after the treatment for less downtime. So you don't have to really worry about downtime. Can they do this in the summer season, Jacqueline?
They can, but it's also recommended to really avoid any sort of sun exposure, as they will be at risk for hyperpigmentation.
Great. And the only other thing about this is you need multiple treatments, okay? Usually we sell a package of 3 treatments once a month, and with that you can see better improvements. Each time you do a procedure, when do you see the results?
So we recommend you to come back 4 to 6 weeks apart from each of your treatments.
Excellent. So the collagen contraction and then the body responding to this takes about 4 to 6 weeks. That's why Nurse Jacqueline brings the patients back 4 to 6 weeks to do the second one. And then as you do the second one, you will see the results of the first one. When you do the third one, you will see more results of the first one and some of the results of the second one. And over time, 3-4 month period, when you're done with the whole session, you do see the results. It's great for texture, as you know, especially when we put that topical stem cell, the cure stem, the exosome. It really smooths the skin. It's great for younger folks like Jacqueline, older folks like me, and so forth. What else do you have to do as a final message to people at your age? If you want to recommend Morpheus, is this something that you would recommend to them?
Yeah, I would definitely recommend it to anyone who's struggling with acne scars. I know that seems to be like an issue. I had acne scars, so this definitely helps. And if you want a little bit of skin tightening, defined facial features, like a snatched jawline, Morpheus is definitely a good treatment.
Absolutely. Somebody at her stage, she doesn't really have laxity, but just a tiny bit of this laxity that will come maybe in 5 years for her. She's still too young. That is a great indication of treatment with Morpheus, because we can do the fixed modes as the girls do and I do myself, and kind of contract the fat and without going under the skin. Because when we go under the skin, of course, we go to the realm of face tight or endolift, which we do extensively in this clinic. And of course, it's more downtime and it's more invasive, to face it. How many cases have you done so far?
Oh man, I can't keep track.
Yeah. So Nurse Jacqueline, her passion is doing lip fillers, and she does a great job. But she does a lot of these treatments, and up to a point that I've actually allocated all my Morpheus to my nurses, and they do a great job. Satisfaction is very high. Call us, ask us any questions you have. We are in Corona Del Mar, California. Have a great day.
Book your appointment.